Hello everyone, welcome to our channel. My name is Zetu. Today I would like us to talk about the preparation of the patient before going for surgery or pre-operative care. The goal of this preparation is to reduce the fear associated with unknown, or as to decrease the stress associated with surgery. Pre-operative preparation include physical as well as psychological preparation. Pre-operative preparation starts early before the patient could go to operation. It needs to be done in the clinic or where the patient will be communicating with the doctor. The surgeon will explain the operation in detail so that the patient knows what is involved into the operation that is going for, and the surgeon will also recommend what is the best for the patient. Once the patient is agreeable about the operation, that he will be going for the operation, there are other people that are also involved in preparing the patient for surgery. One of them is the anaesthetist. The anaesthetist is the doctor who will be putting the patient to sleep. The anaesthetist will also explain to the patient the anesthesia that is going to be given to that patient. Operations can be done under local anesthesia, sedation, and they can also be done under general anesthesia. Therefore, the anesthetist will explain more about type of the anesthesia that can be used, and he will also give the recommendation pertaining to the condition of that patient. The patient will be advised to bring in the clinic all the medication that is taken so that the surgeon or the anesthetist will know which medication that needs to be stopped before the operation. Some medication needs to be stopped 48 hours or 72 hours prior the operation. Therefore, it's important for the patient to be explained so that he will follow that instruction. Another important step is the fasting. Patient will be advised to fast for so many hours before coming to theater. The reason for fasting is important for the patient to come into theater with an empty stomach, because in theater patient will be given an injection that will relax the body so that it will be easy for the surgeon to operate, and those are muscle relaxant. And if the patient has got a full stomach, there is a possibility that after muscle relaxant has been given, the whole body is relaxed, and if the stomach is full, there is a possibility that the patient can vomit, which is very dangerous, and that complication may be avoided if the patient is educated and knows the danger of full stomach that can lead into vomiting and that can lead into aspiration, which is a serious complication. The patient will also be advised or be instructed to try to help towards infection. The patient will be advised to have a full bath or shower, including hair wash, on the day before surgery and even on the morning of operation. And when he's having this bath on the morning of operation, he mustn't put any lotion into the skin, because in the operating theater they will be using cleaning lotion, and if the patient put body lotions or any perfume into the skin, it can counteract with the lotions that can be used in theater. The main aim here is to try to minimize the infection. Therefore, the skin must be normal when the surgeon is using the cleaning lotion in theater. And we are trying to avoid any infection that can set in. It is also important for the patient to be advised to remove all jewelry when coming to theater, false teeth if he has got any false teeth, no makeup. The patient needs to come with her normal skin. All this helps. If there is a change in the patient's skin, it is easy to detect if there is no makeup that has been used. And if the patient is explained properly, you will find that the patient will be so cooperative and make sure that all those things are removed. And during preparation or preoperative preparation, the patient must also be advised about the post-operative care. Patient must be informed that after surgery he may have pain or he will have pain. Therefore, pain management will be given. That is important because you'll find that some of the patients, they don't even say even if they are having pain. Although the people that will be looking after the patient, they make sure that each and every observation, they ask the patient whether he's having pain. Therefore, if the patient knows that there are people that are surrounding her, if he's uncomfortable, he must also say. The patient must also be informed that after surgery, he will be monitored in recovery room, and that is when he can discuss with the people if he is uncomfortable. And another thing that needs to be taught to the patient is about breathing exercises. Breathing exercises, it's important, that will actually help with the oxygenation. And because of the operation, especially the abdominal operation, you'll find that the patient maybe is not taking nice deep breathing. Therefore, it's important that even if he feels like coughing, he must support the abdomen or using the pillow so that he can cough. All that will help for the lungs and oxygenation as well. Early ambulation. Once the patient is in the ward, it is also important for the patient to be educated during the pre-operative patient that once he's in the ward, he must try to move or to exercise so that to prevent any deep vein thrombosis. If possible, he can, if it can be done, he can go to the bathroom slowly with the help of the people that can support, and so that at least he's improving the circulation. All these things is important so that if the patient knows why he's doing this. You'll find that on the back of the patient, even if he's in pain, he will try to do because he knows that these things are going to help the patient. For today, we will end up here. If you do like these short videos, please subscribe, comment, and share. Thank you for watching. Thank you for the support. Till next time, stay safe and stay healthy.